Good morning, everyone. This is Ashok Agarwal, and on behalf of the Global Andrology Forum, I warmly welcome you to our second webinar on the basics of advanced research. This is a seminar which is happening today on Saturday, February 24, 2024. Let us begin. Next slide, please. So today's program, which you have seen, uh, includes an exciting program on teaching all of you and discussing about training for clinicians and non-clinicians in various important topics related to research methodology for systematic review and meta-analysis. We have a galaxy of speakers who are all senior members of our program, Global Andrology Forum, which you see here on the screen, and you will be listening to each and every one. Dr. Rosella, Dr. Ramadan. Okay, so let me go to the next slide, please. Today's program, we have a huge response. The registration has crossed almost close to 550 registrants, and they come with different background, as you can see. And the important part is many of you are members of the Global Andrology Forum, about 60%, but remaining are those who are interested in becoming members of the Global Andrology Forum. The major reason that you would like to attend this workshop, you have said in the form, is that to improve your knowledge about the systematic review and meta-analysis. And many of you have come from all over the globe. So far in the program, we have 64 countries. So briefly, what is the Global Andrology Forum? Let's go to the next, please. Global Andrology Forum was started about 2.5 years ago. It is an international online group which collaborates for andrological research. So it is a free virtual research group for advanced research focused on andrology. Anyone can join. Let's go to the next. Our mission is to conduct highest quality research, including systematic reviews and meta-analysis. And that is why we are conducting this workshop. Next slide. Our vision is to create a global collaboration of clinicians and researchers and to aspire to reshape the future of andrology. Next slide. We have, as of last month, close to 730 members from more than 84 countries. And you can join us as well. Next slide. And you can be an andrologist, embryologist, or any number of profession with an interest in male infertility, andrology, and sperm physiology. Next slide. You can become a member by going to the website. You can just look up globalandrologyforum.org and you can find us on internet and just go to our website and you can apply to become a member. Membership is free. Application is few minutes. Next slide. After this webinar, we have planned a question and answer session. Today's program has been recorded, although all our speakers are available in this program. They are live, but to maintain the time, we have recorded the program. So in terms of the questions, you can send them by chat if they are easy. If we can, we will try to answer them live on chat. Otherwise, we have created a program for question and answer separate on Saturday, March 9th. And you will get the link to join that where we will answer all your questions. Next slide. Thank you very much. Now we will begin with our first presentation, and I will introduce our first speaker, who is Dr. Rosella Canarella. May I have the first slide, please?
Particular pleasure.
This is, can we have the learning objective slide? Okay, Dr. Rosella's who is going to be explaining and teaching us today about many of the things that you see here in her slide. So these are the main topics that will be covered by her in her presentation that you will be able to see. So I will ask you if you have taken the pre-test. Now the pretest is being closed. The link to the pretest has been closed. After the webinar, we will open the post-test link where you can take the test to see if you have learned and improve your knowledge. And that link will stay open for almost a month to allow you to take the test, which includes only 20 questions at your leisure. So please now watch the presentation by Dr. Rosella, which is a recorded presentation. All our talks are recorded, but all our speakers are also available online. Thank you very much. Please enjoy the video now.
Good morning, everyone. It is a particular pleasure for me to be here today to present this topic, systematic review, meta-analysis, and overview. Let me express my greetings to all of you, and also I thank Professor Agarwal and Professor Shah for organizing this very interesting course. A special thanks also to Dr. Ramadan, who has given a particular look to all the slides and helped us to coordinate everything. And thanks also to Hiva that is doing a wonderful job with our training. So let's say I'll start with the topic. So the objective, the learning objectives of this lecture is try to understand what a systematic review and meta-analysis is, and understanding also the importance of a systematic review and meta-analysis in literature. We will see that if we run a high quality meta-analysis, it can be a really useful source to write guidelines. So it's very important for evidence-based medicine. We will learn how to conduct a systematic review and meta-analysis using specific checklists that ensure the quality of our article. And we will also see the main mistakes that can be conducted during systematic review and meta-analysis, and some tips or advice that can help us to avoid some of these mistakes. So we know that there are several types of study design. Dr. Ramadan will explain this in great detail, but what I want you to tell you is that the systematic review and meta-analysis is a way, it is a particular kind of study design that do a quantitative formal analysis by systematically evaluating all the studies available on a specific topic. We know that on a specific topic, if we look at the literature, there may be several, even thousands somehow for specific topics of studies. And sometimes what happens is that the evidence shows some controversies. So some studies, for example, point toward a specific direction, for example, the impact of a drug on a specific disease, while some other studies shows different results. The meta-analysis allow in a systematic way to quantitatively analyze the evidence of these studies in order to make conclusions about those studies, even if the evidence is controversial. So it's a study that is particularly important to guide the clinicians during their practice. So how can we run a high quality meta-analysis? So first of all, we need to have a clear research question in mind. Do you think, guys, that this question is good? So, for example, as you read the question, maybe we want to investigate the impact of testosterone replacement therapy on cardiovascular health. This is not a really good question because it is very imprecise. There are a lot of details that needs to be specified in our research question. For example, we need to understand which is the population that we are going to analyze, like patients over 50, patients under 50. What are we targeting? The intervention. So we are looking for testosterone replacement therapy, but like what kind of drugs, like of formulations? There are several, injective, topical. So what are we looking for? In the outcome, we just say cardiovascular health, but we need to be more precise. That's why it is important to mention in our research question to use a tool that is very interesting, very important, that helps us in making a comprehensive question. It is what is called the PICO question. PICO because every letter of this word stands for something. P is the population. So we need to be really clear about what are the inclusion and the exclusion criteria of the population of our research question. The intervention, so this is particularly important if we are going to enroll, to include randomized controlled studies, because this kind of studies, as Dr. Ramadan will say after, are studies that have an intervention. So we need to understand which kind of intervention we are looking for and if there are exclusion. So intervention that we don't want to include. Comparison. So what is the comparison group? What characteristics should the comparison group have? The outcome, we need to specify exactly which is the outcome that I'm going to analyze in my meta-analysis. And sometimes the PICO question has also the study design. This is a kind of modified PICO question. So in this table, you can see even a row for the study design, and so we are able to include details about which studies design are we going to include, because some meta-analyses, for example, are only on randomized controlled trials, which is good because this allows a high quality meta-analysis. Some other may be only on observational studies, for example, when randomized controlled trials are not available. A modification is when we are not really looking for an intervention, but we are looking for exposure. So an example, maybe to study the impact of varicocele repair. In majority of studies, you see that patients undergo to varicocele repair, but it is not a kind of intervention. They are like observational studies, so they are exposed to varicocele repair. And so, for example, you can do a before-after analysis in that case, or a comparison to a specific group. But in that case, so in the case of observational studies, there is no an intervention. There is an observation of a specific event. So in that case, the table that you need to use is called is the PECO, actually, because you use the exposure to a specific aspect and not the intervention. Okay, there is no intervention, no randomization of the exposure to the intervention. Okay, so when we design a systematic review meta-analysis, as we said, we need to have in mind a complete research question, and we have already seen the PICO table that allows us to create a comprehensive research question. We need, anyway, to understand how to search the studies we are looking for in the available databases. So we need to look for specific database. Examples can be Scopus, Embase, Cochrane, PubMed. We need to clarify the timeline of search. For example, we started the search on March 1st, and we did it until March 31st, for example. So we need to clarify when we did the search. We need to clarify if there is any language restriction and if there are other restrictions in general. So our search strategy need to be really clear. Then, after that we clarify the search strategy, we will retrieve studies. And we will need to understand, reading the title, reading the abstract, exactly which study are eligible and which are not, according to our PICO question. So after this process, we will have identified a specific number of abstracts that satisfy our PICO question, so we can use the full text of those articles considered eligible, and we can read them carefully and see which of them really satisfy our research question. And then we can do the qualitative synthesis. So it means that we read the studies and try to synthesize basically this content. The qualitative synthesis is something that is done when we cannot run really a meta-analysis, and then we do only a systematic review. But when we can run a meta-analysis, what we do is a quantitative synthesis. So it means that we extract the numerical data of the outcome that we are interested in, and then we analyze them. This is what is called the PRISMA flowchart. It is a diagram that allows to synthesize in a single picture the process that we follow during the identification, screening, eligibility, and inclusion of our articles. So in a single picture, you can see how many articles have been retrieved using our search strategy. How many duplicates have been removed, how many abstracts have been screened, and how many have been excluded among them. Then how many full text articles did we assess for eligibility, and how many of them were excluded with the reasons, and finally how many articles we did include in our meta-analysis. This is the what is called the forest plot. So this is the result basically of a meta-analysis. So once that we extract the data, then we analyze them using specific program. So you can see the studies, each row basically correspond to a specific study, and then you can see two groups, the patient group and the control group. In this case, what you find is that the patient group are patients treated with antioxidant. In the control group, you find patients treated with placebo or no treatment. In the last row, you basically can find the number of patients in the patient group, the number of patients in the control group, and then the results. This is the odds ratio, so the risk for a specific outcome, which in this case is pregnancy. And this is the diamond basically, which resumes the results. So in this case, the risk for having the outcome studied is higher in patients compared to controls, allowing to think that the intervention, in this case the antioxidants, have a role and impact in the observed outcome. So this is basically the structure, the real structure of a systematic review and meta-analysis. If we run it correctly, we can use it to write the guidelines. So when a panel of experts write guidelines before including specific meta-analysis, what they do is to do the critical appraisal of the specific meta-analysis. And if the quality is fine, it satisfies the criteria that this tool present, then they are going to use this meta-analysis. So what are these criteria? First of all, the meta-analysis need to have a really specific study question. So the hypothesis that the authors investigate has to be very clear, and it has to be stated in the title, in the abstract, in the introduction. For example, if we look at this meta-analysis, we see the hypothesis clearly stated in the title. So the hypothesis is to investigate the effect of antioxidants on natural pregnancy and semen parameters in infertile men. And this actually is stated also in the abstract. If you look through the introduction, you will see the context where our aim is framed in. So these are the criteria, the first criteria of our critical appraisal tool. Another question is, maybe relevant studies missing. So we need, the panel, what they do is to focus on the search strategy, on the methodological section of our paper, and see if specific point and relevant point are missing. So ideally, the search strategy should include not only one database, but more than one. And the most important are these ones: PubMed, Scopus, Medline, Cochrane, Embase. Google Scholar, for example, is not a good one. We need to rely on the one you see in the slide. We need to include the list of relevant studies in the results. So after, in the results, we need to see, okay, we excluded that study, and then we included these studies, and then we put the references of the included studies. We should not limit the studies to English articles. We need to use both mesh terms and text words, and this information should be retrieved in the method and the result section of our paper. So for example, in this article, you can see the detail of the databases that have been used for the search strategy. You can see that more than one database has been used, and all of them are reliable one. And you can see also a really comprehensive search strategy where allows the repeatability. This is very important, because if you are very careful and very precise in mentioning your search strategy, you allow the researcher to repeat what you did. And repeatability is something that speaks of reliability of a study. Then the panel asks if the methodology is appropriate. So if the inclusion-exclusion criteria are stated, if the PICO-PECO question is there. And this information should be found actually in the method section. So this is an example of the PICO question, the one we saw before. But in the specific study, you can see that, for example, this is a study that has been carried out in patients that are infertile, while you can see all the exclusion criteria used for the population. You can see the intervention, so what kind of drugs in this case have been considered, what kind of molecules have been excluded, what is the comparison, so what are the characteristics to which the control group must be exposed to, and which are the outcome, and they are very detailed. So the PICO question actually is a really important tool because within a single table, it allows to have a really clear idea of what the researcher is looking at. And then you can see the Prisma flowchart that I described before, where you can see the result of the process coming from your search strategy and your PICO table. Then we need to see if the included studies are of sufficient quality. And to see that, the studies must be analyzed for the quality of evidence. And there are several tools that allows us to evaluate the quality of evidence of the studies. One important thing is that the tools changed based on the study design. For example, in this study, only randomized controlled trials have been included, and the Cochrane risk of bias has been the main tool, together with the CONCERT and the JADA checklist, used for this kind of studies, because all of these checklists are used for the randomized controlled trials. So it is very important to add the way the tools used for evaluate the quality of evidence in the method section and the results of this evaluation in the results section. Then we need to see if the study that we are including are homogeneous or are heterogeneous. And there are specific statistical tests that allow us to see if the studies are heterogeneous. The presence of heterogeneity may somehow make our results a little less reliable. And so if we found statistical heterogeneity, we need in the discussion to justify it. It may be due, for example, to slightly different inclusion criteria used among the studies. So we need to find out why we found it. One of the tools, Dr. Ahmed will explain more about that, is the I-square test, which allows basically to understand if we have interstudy heterogeneity or not. And the analysis can be adapted based on the presence of heterogeneity or not. In fact, if the analysis show the presence of heterogeneity, we need to use the random model for the analysis. In presence of homogeneity, we can use the fixed study. So there are particular, things that we need to know in case of heterogeneity. So let's talk now of the Prisma checklist. What is the Prisma checklist? It is just a checklist that is very important because it allows us to understand which are the items that we need to include in our study to allow our study to be a good one, a high quality one, a reliable one. And so if you look at the Prisma checklist, you will find specific items regarding the title, the abstract, the introduction, the methods, the results, the discussion, and there is also the other information section. We will look, for time reasons, only the methods and the results section. So if you look at the methods, you can see that there are specific items that must be reported in our method section. So it is actually a very important tool because guide us during the writing of our article. And I will give you some example. The evaluation, the clarification, the mention of our eligibility criteria in the method section is very, very, very important. And it needs to be done in a very careful manner. So in this meta-analysis, for example, you find a full paragraph that describe which are the eligibility criteria of the studies we are looking for, the information sources, so which databases did we use, the search strategy, exactly what is the K-string that we are using to conducting our meta-analysis, how did we collect the data, okay, so which kind of items did we include it in our spreadsheet and how did we collect them. For example, in the Prisma checklist, the fact that this should be done in with double checking, so in pairs, it is very important. Risk of bias assessment, so evaluation of quality of evidence, basically. The effect measures, so how did we analyze? Did we use the odds ratio? Did we use the mean difference? These are statistical aspects. And the synthesis methods, okay? So again, these are statistical aspects that Dr. Ayad will explain later. And then we have the results. Again, in the results, we can be really precise if we use the Prisma checklist tool. So the study selection, so the description of what is reported in the Prisma checklist, in the Prisma flow chart, is the first item that must be included in our results. We just need to describe the results of our search strategy and assessment of eligibility process. This is the table which explains the specific study characteristics of all the studies that we included. And this is another important items that we need to include in our meta-analysis. Then we need to include a table that presents the results of the assessment of quality of evidence of the articles that are eligible, that have been included. And then we include the results, basically, of the outcomes, so the stats, basically. So we describe the results, the forest plot, the funnel plot, etc. So going toward the end of this lecture, what are the problems that we may find? Dr. Ayad will be more precise about that, but I wanted just to tell you 2 points. The first regards the missing studies. What may happen is that we don't have a PICO question, okay? We have a general idea of what we are looking for, but we did not write down a PICO table, and so we start the eligibility phase without the PICO criteria. This is a mistake, because we are not clear about the inclusion criteria, and we risk to miss study in this way, or to include studies that are not eligible. So it's very, very important that first we write down our PICO criteria and have a clear idea of what we are looking for, and then we start the eligibility. Another point is that sometimes we start the meta-analysis. There are, for example, thousands of studies that need to be assessed for eligibility, and in the meantime, authors publish on the topic. So after that we complete the analysis, we may want to recheck again the literature before publishing the study to see if we found if any missing study have been published during our eligibility or analysis phase. Second, reliability of the spreadsheet. It is very important to properly extract the data, and Dr. Ayad would tell you something about that. So be mindful. If we need to extract means, you don't extract medians. It's very important. What I want to stress is the importance of the control group. We cannot mix apples with oranges. If we know the characteristics of the control group, all the studies must have the same specific control group. For example, in this plot, you can see that the patient group is patients with recurrent pregnancy loss. So all the studies included have in the patients group patients with recurrent pregnancy loss. The control is fertile control. So all the study have patients with fertile as control group. So it's very important that the group are homogeneous, because otherwise, so homogeneous in terms of the inclusion criteria of so the patients that makes the patients in control group is very important, because otherwise the statistics does not make sense. So these are my take-home message. A meta-analysis is a study that systematically assesses the results of previous research to drive conclusions about a specific body of research. It involves the screening, the assessment of eligibility, and the data analysis. The quality can be evaluated using the critical appraisal tool, which are very important because allow us to design a high-quality study that may be amenable to future guidelines and to evidence-based medicine does. So the PRISMA checklist is a tool useful to make high-quality meta-analysis, and as we saw, it's very useful because guide us during the process, and so allows us to do a very comprehensive and high-quality work. So this is all what I have. These are links that may be useful to go more a little bit more, to get more the sense of what I said. So there are checklists for quality of evidence assessment that you can look for, and other checklists like the MOOS checklist that are for observational studies. So thank you so much, and I am open to question now.
Thank you very much. This has been an outstanding presentation by Dr. Rossella Canarella. I congratulate Dr. Rossella for really laying out the fundamental blocks for conducting advanced meta-analysis of highest quality. So she explained about the PICO, she explained about the PRISMA, she explained about how to do the quality check, and provided a wealth of information, which is really essential for anyone who is interested in learning about research. And whether you are a clinician, whether you are a scientist, whether you are an andrologist, or whether you are working in the lab, it doesn't matter. I think her presentation really should provide you the basic foundation of understanding how these kind of studies, which are called a meta-analysis, can be conducted, how to understand what are the ingredients of conducting such kind of complex, advanced studies. This is the first time in the world somebody is teaching you about these studies, especially in the context of andrology. I don't think any such type of course has been focused to upgrade the knowledge of clinicians and researchers in such a reliable manner. So I congratulate her, and at the same time, I want to introduce our second speaker, Professor Ramadan Saleh, who is an outstanding clinical andrologist from Egypt, a very long time friend and a colleague, and he is a senior advisor in the Global Andrology Forum in our management, and also the chief research supervisor. So he is going to talk about the study design of eligible studies in systematic review and what are the errors or remedies. So I want Dr. Ramadan for quickly to tell what are the learning objectives of his presentation today. Dr. Ramadan.
Yeah. Hi, everyone. It's a great pleasure for me to participate in this wonderful webinar on advanced research. I would like to thank Professor Agarwal and Professor Rubin for giving me this nice opportunity to talk to you today. I would like also to thank Dr. Rossella for her excellent presentation and the explanation of all and the different aspects of conducting systematic reviews and meta-analysis in a very nice way. Actually, my talk today will be focused on study designs. I will highlight and explain different types of medical study designs and will explain the importance of properly recording the study designs which are included in a systematic review. In the last part of the presentation, I will explain where and how to find the study design in a published article, and also point out to the source of errors which may occur during recording study designs and how to avoid those errors.
Okay, we can begin the video now. Dr. Ramadan, thank you very much. The video can be
Hi
started.
everyone, my name is Ramadan Saleh. I am a professor of dermatology, venereology, and andrology from Egypt. I'm the chief research supervisor and a member of the core management team of the Global Andrology Forum. It's my pleasure to participate in this important course on advanced research, and my talk today will be focused on the study design of eligible studies in systematic reviews and meta-analysis. In the first part of this lecture, I will discuss different types of study designs in medical research and will highlight the importance of properly recording the design of studies included in a systematic review. And then I will provide examples of errors in recording the study design and the best practice to avoid these errors. There are two broad categories of study designs in medical research. The first category includes observational studies, and the aim of observational studies is to investigate the potential relationship between a certain exposure and an outcome of interest. Examples of observational studies are those studies which explore the relationship between varicocele, which would be the exposure in this case, and male fertility potential, which would be the outcome. The second category of study designs include interventional or experimental studies, and the aim of interventional studies is to investigate the impact of an intervention on a desired outcome. And examples of interventional studies include the study of the impact of varicocele repair, which would be the intervention, on male fertility potential, which would be the outcome. A third type of study designs is the systematic review and meta-analysis. And this particular type of studies aims to explore the pooled effect of exposure or intervention on a desired outcome using previously published original observational studies or interventional studies, provided that these original studies have the same research question or the specific aim. As you can see here in this table, observational studies could be cohort studies, case control studies, cross-sectional studies, or case reports and case series. The first three types, which are the cohort, case control, or cross-sectional studies, are eligible for inclusion in systematic reviews and meta-analysis, while the fourth type, which are case reports and case series, cannot be included in systematic reviews and meta-analysis due to the small number of individual cases included in these case reports and series, and the retrospective nature, as well as the lack of control group. In terms of the direction of events in observational studies, cohort studies are either prospective or retrospective. On the other hand, case control studies are always retrospective, while cross-sectional studies are looking at simultaneous events and they are prospective. The second category of research designs, as we mentioned, which are the interventional studies, are either randomized controlled trials or non-randomized controlled trials. Now let us know how to select the proper study design in clinical research. Actually, this relies mainly on the research question. So, if you would like to investigate the prevalence of a certain condition or a disease, in this case, we can use cross-sectional studies. While if you would like to investigate the risk of exposure to a certain condition or a disease, in this case, cohort studies or case control studies can be used. On the other hand, if you would like to investigate the benefit or the harm from an intervention or therapy, randomized controlled trials are the best design to answer this question. And if for some reason we are unable to conduct randomized controlled trials, in this case, results emerging from cohort studies or case control studies can be used as an alternative. And now let us talk a little bit in more detail about each of these study designs. And let us start first by cohort studies. As we mentioned in the beginning, there are two types of cohort studies. One is prospective and the second is a retrospective cohort. And as you can see in this figure, it demonstrates the design of prospective cohort study, which includes two groups of participants. One is exposed to the risk factor, and the second group is not exposed to the risk factor, and this would be the control group. Both groups are followed for a long period of time in order to check whether the desired outcome is present or absent. The prospective cohort studies are extremely time consuming. They may require a long follow-up period of years or even decades in order to get meaningful results. Of course, during this long follow-up periods, many of the participants may be lost, and therefore there is a potential risk of bias of the results of these studies. On the other hand, retrospective cohort studies, as you can see in this picture, these types of studies are conducted on data that have already been collected, such as those from hospital records. These studies begin and end in the present time. Despite the limitation of these types of studies being retrospective, they save a lot of time, efforts, and expenses as compared to the prospective cohort studies. The second type of observational studies is the case control studies. And as we mentioned in the beginning, case control studies are always retrospective in nature. These types of studies involve two groups of patients. One group is positive for the outcome, and this is described as the case, and the second group is negative for the outcome, and this is described as the control. We have to look into the medical records of these two groups in order to see whether each group has the risk factor present or absent. This is an interesting study, which is a very good example of case control studies. In this study, the investigators looked at the database of more than 9,000 men presenting as partners of infertile couple. And as you can see here in this table, the study population was divided into two groups, men with abnormal semen parameters, and this was considered as the case, and men with normal semen parameters, and this was considered as the control, and both case and control groups were compared for the presence and absence of varicocele. The third type of observational studies are cross-sectional studies, and these studies are used to analyze data that are collected on a population at a certain point of time, rather than over a period of time. These types of studies are suitable for determining the prevalence of a certain disease or a condition. And now let us move to the randomized control trials, which are the ideal study design to investigate the effectiveness of a particular therapy or intervention on a desired outcome. This is a very good example of randomized controlled trials. This paper was published in European Urology Journal in 2011 by Professor Taha Abdelmajid and his team. Professor Taha is one of the senior GAF members. The team investigated the impact of varicocele repair on male fertility potential, and this was a randomized controlled trial. And as you can see here in this figure, Professor Taha and his team followed the consort guidelines for conducting clinical trials, and they followed the four-step protocol of enrollment, allocation, follow-up, and analysis. And as you can see here in this table, the results of this study indicate significantly higher sperm concentration, sperm motility, and normal sperm formed in men who were subjected to varicocele repair as compared to those without varicocele repair. And now let us talk a little bit about systematic reviews and meta-analysis, because this topic has already been covered very nicely and in detail by Dr. Rosella in her lecture. I will just share with you some of the recent systematic reviews which were published by the Global Andrology Forum. In this study, we investigated the impact of varicocele repair on semen parameters in infertile men. In the second study, we reported our findings with the impact of varicocele repair on sperm DNA fragmentation and seminal oxidative stress in infertile men. There are three additional systematic reviews on the impact of varicocele repair on different outcomes, including the impact on total testosterone level following surgery, the outcome of assisted reproductive techniques, and the impact of varicocele repair on sperm retrieval rate and reproductive outcomes in infertile men with non-obstructive azoospermia and clinical varicocele. Additionally, we have 10 more systematic reviews on the impact of varicocele on male fertility potential, and the ones which are highlighted in green by team number 5 on the impact of varicocele on oxidative stress markers in experimental animals. This is embraced in the World Journal of Breast Health, and the project by team number 2 on the impact of varicocele on levels of anti-sperm antibodies is recently accepted in the World Journal of Men's Health, and the remaining 8 projects are at different stages of development. Now let us know where to find the study design of a published article. The first place is the title, and this is important in articles published as randomized controlled trials or systematic reviews and meta-analysis. The second place is the abstract, and this is done in most published articles. And the third place is the method, and this should be the case for all articles. And this is an example where the study design is recorded in the title of the paper and also in the abstract. This is another example of retrospective cohort study in which the study design is recorded in the abstract of the paper. And this is another retrospective cohort study in which the study design is mentioned in the abstract as well as in the methods section. Now, let me show you examples of errors which may be seen during recording the design of studies included in a systematic review and meta-analysis. As you can see here in this table, the study number 1 is described as prospective non-randomized controlled study, and this description is correct. However, There is no need to mention the word prospective because all randomized controls should be prospective. The study number 2 is described as retrospective, and this is incorrect because it does not tell any information about the exact study design. The study number 3 is described as prospective randomized trial, and this description is correct. However, again, there is no need to mention the word prospective here. The study number 4 is described as observational control, and this description is incorrect because it does not tell the exact study design. The study number 5 is described as prospective, and of course this is incorrect because again it does not tell the exact design of this study. The study number 6 is described as placebo-controlled double-blind trial, and this description is correct, and it can also be described as randomized controlled trial. The study number 7, although being described as prospective, non-controlled, observational, and the description is unfortunately incorrect because again it does not tell any information about the exact design of this study. Another source of error is when the study design is written incorrectly in the original paper, and as seen in this example, it is saying prospective case control study. And in our lecture today, we explained that case control studies are always retrospective. So in this case, we need to carefully read the methods of the paper and then know the exact study design so that we can record it correctly in the data extraction sheet. Actually, it is important to record the correct design of studies included in a systematic review and meta-analysis. This is important for the accuracy of data extraction and for drawing firm conclusion from the systematic review. And of course, all of us know that the study design is directly related to the level of evidence. And as we can see here, systematic reviews provide the highest level of evidence, followed by randomized controlled trials, and then the observational studies. I think it is possible to reduce and even completely avoid errors in recording the design of studies included in systematic reviews and meta-analysis, and this can be done by understanding different types of study designs and by careful reading of the methods section of the eligible studies. And finally, understanding different types of study designs and accurate data collection are essential tools for conducting high-quality systematic reviews and meta-analysis. And thank you all for your attention.
Thank you very much, Professor Ramadan, for an excellent presentation, really laying out what are the common mistakes that researchers make when they conduct these kind of meta-analysis. Very common things that with some knowledge and training, they can completely avoid. And I think your presentation really hit the nail, telling exactly point by point by showing such beautiful examples from the studies. And I think we congratulate you for such a wonderful presentation. I must tell everyone that the problems that Dr. Ramadan has shown are real problems, and we see those problems in so many studies that are being published, even in the topmost journals in the field that we are, whether they are Nature or whether they are Science or Lancet. So people are publishing very high in very high impact journal these meta-analysis, but essentially they are not really trained. They are not trained. So they are conducting these meta-analysis without a proper understanding of how these studies must be conducted. And they lack the basic background in terms of identifying the mistakes that are happening. So this particular series of talks that we have today are extremely valuable. It really will allow you to empower you to understand how the studies should be recognized, how they should be conducted, because meta-analysis is the highest form of evidence, medical evidence, on which all the medical recommendations are chosen by the professional societies and which impact millions of patients all over the world. So it is extremely valuable that we understand what kind of mistake. And the next speaker, Dr. Ahmed Haraz from Egypt and Kuwait, he is going to talk about many other things which are extremely valuable. And I want to tell Dr. Ahmed is our senior chief statistical supervisor or advisor in the Global Andrology Forum, and he has done a remarkable job. He's a urologist by training, and he's a transplant urologist. We are still trying to make him an andrologist, but let us see how it goes. So he's going to tell us what he has planned for you today. Please, Dr. Ahmed.
Thank you so much, Dr. Agarwal, for the opportunity. So today we will try to learn how to read a forest plot and to learn the measures of heterogeneity and how these measures impact our preference for choosing random versus fixed effect models during the meta-analysis. We will introduce also the concept of sensitivity and publication bias, how to read the funnel plot, and finally, we will learn how to make our data sheet a statistician friendly. So let's go to the lecture.
Please begin the presentation. Thank you very much.
Hello, everyone. Assalamu alaikum. This is Dr. Ahmed Harraz, and it's my pleasure to present you this lecture. Practical example. A group of researchers designed a study and would like to know the difference in sperm concentration and the pregnancy rate between patients with varicocele and those without varicocele. So, what is sperm concentration and the pregnancy rate? And what we call patients with varicocele and those without varicocele. Sperm concentration and the pregnancy rate are the outcome of interest. And the comparison groups are the patients with varicocele and those without varicocele. So, as a baseline, there is a comparison group and an outcome of interest for each study. Okay, how do we measure sperm concentration and how do we measure the pregnancy rate? Regarding sperm concentration, it is measured in units, like million per ml, and it is described as mean plus or minus standard deviation. In comparison to pregnancy rate, it is a proportion and it is measured by percentage. For example, the pregnancy rate was 20% in group A compared to group B, which was 45%. So for the purpose of meta-analysis, from each group, we need to know the number of patients, the mean of sperm concentration, and the standard deviation of sperm concentration. And since these three variables are required for each group, we need a total of 6 variables. In comparison to pregnancy rate, which is a proportion and is measured in percentage, we need the number of patients and the number of those who get pregnant in each the case and the control group in patients with varicocele and those without varicocele. So a total number of 4 variables are needed for this purpose. So, for each study, the first step of the meta-analysis is to use the 6 variables in case of sperm concentration, or the 4 variables in case of pregnancy rate, and use these variables to calculate the effect size. In case of sperm concentration, we are interested in calculating the mean difference between both groups. So the first step of the meta-analysis is to calculate the mean difference between both groups and the 95% confidence interval of this mean difference. On the other hand, for the pregnancy rate, the effect size is the odds ratio. What does it mean, odds ratio? Odds ratio is the ratio between the percentages of those who get pregnant with varicocele compared to the percentages who got pregnant in those without varicocele. So, as a conclusion, the meta-analysis will calculate the effect size. What is the effect size in the case of sperm concentration? It's the mean difference and its 95% confidence interval. What is the effect size in case of a pregnancy rate? It is the odds ratio and its 95% confidence interval. For each study, how to represent this effect size? It is simple. There is a blue square that represents the effect size, which is the mean difference or the odds ratio, and there is a flat line which represents the 95% confidence interval. This means that the mean difference or the odds ratio could be any value between the ends of the confidence interval. In 95% of cases, this is why we call it 95% confidence interval, as we can see here. For the purpose of graphical presentation of the effect size and its 95% confidence interval, let's take a look at this left side graph. We can see that the bottom line is the 0. What does it mean, 0? 0 means that the mean difference between group 1 and group 2 is 0. This means that they are equal. Okay, so we would like to see the mean difference of the study and its 95% confidence interval. We can see here for these two studies that also the mean difference is different from the 0 line, but the confidence interval is intersecting the 0 line, which is the midline. This means that there is a chance that the mean difference between both groups could be 0, because 0 is within the range of the 95% confidence interval. This means that these results are not significant. There is no significant difference between both groups regarding the mean difference. Let's look at the graph on the right hand side. The bottom line is 1. Why 1? Because we are dividing the ratio of pregnancy in group 1 divided by the ratio of pregnancy in group 2. So we are dividing ratios, and the ratio, when the denominator is equal to the numerator, the ratio will equal 1. So if the confidence interval of the effect size, which is the odds ratio, crosses the midline, intersects the midline, this means that the odds ratio might be 1, and there is no difference between both groups regarding the proportion or the percentages of pregnancy in group 1 in comparison to group 2. Another example, we can see here on the left hand side that the mean difference, which is the effect size, is on the right side, on the positive side, and the confidence interval does not intersect the midline. This means that group 1 has a bigger mean in comparison to group 2. And this is statistically significant because the 95% confidence interval does not intersect with the midline, which is the zero line. Regarding the odds ratio, we can see that odds ratio is more than 1. Odds ratio is the effect size, and it's more than 1. And the 95% confidence interval does not intersect with the midline, which is 1. So this result is statistically significant. This means that group 1 has higher rate of pregnancy when compared to group 2. And the result is statistically significant. Another example, we can see that the effect size is negative. It is on the left side of the midline regarding the sperm concentration. This means that group 2 has higher mean of sperm concentration in comparison to group 1. The next question is whether is this statistically significant or not. Yes, it is statistically significant because the confidence interval does not intersect with the midline, which is the zero line. The same exactly applies to the pregnancy rate. We can see that pregnancy rate, the effect size, which is the odds ratio, is less than 1, meaning that group 2 has higher rate of pregnancy in comparison to group 1. And the results is statistically significant because the confidence interval does not intersect with the midline, which is referred to number 1. As a quick summary, the meta-analysis deals with either the mean difference or the odds ratio. Mean difference when I subtracting means between two groups, and the odds ratio when I am dividing ratio of an event in one group compared to this ratio of the same event in another group. For the purpose of data collection, for sperm concentration, for the mean difference, we need 6 variables, 3 for each group. The total number of patients, the mean of the sperm concentration, or whatever variable you are analyzed, and the standard deviation. So a total of 6 groups. When we are dealing with the odds ratio, we need a total of 4 variables. The total number of patients and the number of patients who got pregnant or who got the desired outcome, and this is needed for both groups, giving us a total number of 4 variables for calculating the odds ratio. We are now displaying 4 studies together within the same plot. For study number 1, it is negative and statistically significant. For study number 2, it is negative and statistically significant. Negative means that group 2 has higher mean than group 1 because we are subtracting group 2 from group 1. Group 1 minus group 2. Study number 3, also it is on the right side, it is positive, but it is not statistically significant because the confidence interval intersects the midline, so there is a chance that the effect size equals 0, the mean difference equals 0. This means that the results are not statistically significant. And study number 4, the same exactly as study 1 and 2, it is on the negative side and it is statistically significant because the confidence interval does not intersect with the 0 midline. The same applies to the pregnancy rate. The meta-analysis will now collect and analyze the 4 study results and give us a final result, a final mean difference or a final odds ratio, a final effect size. This process is called pooling of the effect size. We will know now how the meta-analysis is pooling the effect size to give us the final result of the meta-analysis. the first step to do that is to calculate or to assess the heterogeneity between these studies. Heterogeneity means that how these studies are homogeneous or heterogeneous or different from each other. We have two main methods to assess the heterogeneity of these studies. The first one is the Cochrane-Q test, and the second one is the I-squared statistic. So regarding the Cochrane-Q test, if the value is more than 0.01, we consider it non-significant. There will be no low heterogeneity between these studies. And if the Cochrane-Q test is significant, which is less than 0.01, we consider there is high heterogeneity. We just ask the statistical program to calculate this for us. Regarding the I-squared statistic, if the I-squared statistic is low, means there is low heterogeneity, and if it is high, means high heterogeneity. Usually, we agree on 40% as a cutoff between the low heterogeneity and the high heterogeneity. Also, some references use different values. But in general, less than 40%, we consider it low heterogeneity, and more than 40%, we consider it high heterogeneity. So, the first step for the meta-analysis is to calculate the heterogeneity between the studies. And the end point is that we know that if there is a low heterogeneity or high heterogeneity between the studies. If there is low heterogeneity, we should use the fixed effect model to pool the effect size. This is what we choose from the statistical program to do. If we find there is high heterogeneity between the studies, we need to select the option of random effect model. By using fixed effect model and random effect model, we can pool or collect the results of these 4 studies and obtain a final result for our test question, research question. This is an example of the pooling process. As we can see a black dot. This black dot is our final result. So this black dot here is on the left side of the midline, meaning that group 2 has bigger outcome than group 1, and it is statistically significant as long as this black diamond does not cross or intersect with the midline. Another example is here, the black diamond crosses the midline. This means that the overall results of the meta-analysis is non-significant. There is no significant difference between group 1 and group 2. Another example, this black dot is on the right side of the midline. This means that the results are statistically significant and the results are in favor of group 1, because in case of sperm concentration, you are subtracting the means. The subtraction is positive and it does not cross the zero line. So it is group 1 has a bigger outcome than group 2, and these results are statistically significant. The same applies for the pregnancy rate for an effect size of odds ratio. The odds ratio is more than 1, and the black diamond does not cross the midline, so the results are statistically significant. This is a practical example of a forest plot from a recently published meta-analysis. We can see that each study is represented by a green square and its confidence interval. And we know that if the confidence interval intersects the midline, this means that the results are not statistically significant. And if it does not intersect the midline, this means that the results are statistically significant. And according to the position of the effect size or the mean difference or the odds ratio, we can know whether it is in favor of group 1 or group 2. In the bottom line of the graph, we can see the I-squared statistic, which is 38%. We consider it low heterogeneity, and the corresponding Cochrane QP value is 0.14, which is non-significant, so we can appreciate that we use this fixed effect model for pooling the effect size. And as long as this diamond, it is here orange, not black, as long as this orange diamond does not intersect with the midline, the results are statistically significant, as we can see from the last or the bottom line of the graph for the test for overall effect, which has a p-value is statistically significant. This is another example with we can see that the I-squared is 99%, and the p-value of the Cochrane Q test is less than 0.01. This means that there is high heterogeneity, so we can appreciate that we used the random effect model for pooling the effect size. And you can see that this orange diamond is on the left side and does not intersect with the midline. This means that the p-value is statistically significant. Another important concept during reading and doing the meta-analysis, which is the funnel plot. Here in the funnel plot, we plot the outcome or the effect size, which is the mean difference or odds ratio, against the standard error. And the result should be like this. We have here 4 studies, 2 studies on the positive side and 2 studies on the negative side. We can appreciate that 2 studies published positive results and the 2 studies published negative results. We can say there now, because of this symmetry in the funnel plot, there is no publication bias. This will be more apparent on the next slide. We can see here that 3 studies published positive results and only one study published the negative results. We can assume that there is publication bias, meaning that the studies with negative outcome is not published, and only studies with positive outcome are published. This is what we call the publication bias, the tendency to publish positive outcome and no publishing for negative outcome studies. This is what we call the publication bias and the funnel plot. So we can give another example. The distribution of the positive and the negative findings can show us whether the plot is symmetric or asymmetric and whether there is publication bias or not. We can appreciate this in this real funnel plot. Another important concept, which is the sensitivity analysis. The sensitivity analysis refers to studying each single study in the meta-analysis by its own, and whether this single study, if removed, if omitted from the analysis, will it change the overall result of the meta-analysis or not? For example, we can look at the gray diamond at the end. This is the actual result of the meta-analysis.
We are looking into the problem with the video. Daniela, can you check what is going on?
number one, when removed, the result of the meta-analysis are the same. There is a statistically significant difference and on the positive side. But look at study 2 and 3. We can see that studies 2 and 3, when removed, the results of meta-analysis became insignificant. So we can see that. And also, and by the way, study number 4 also. So we can see that study 2, 3, and 4 are sensitive studies, because if we remove them one at a time, we can change the results of the meta-analysis. This is very important to judge the integrity of the meta-analysis. Now we go to the last part of my presentation, which is the data entry. This is an example of a data entry sheet. We can see that usually we have an ID variable. We give each study a number, a unique number, and we can see that if one study has subgroups, we give them separate numbers, 2.1, 2.2, 2.3, referring to the study number 2 and its subgroups. This is very important for us to have this ID in order to mark the studies if there is a problem in certain study. The second part is the authors. It's usually recommended that you use a unique and uniform format for writing the authors. For example, the first study, study number 1, with ID number 1, has the last name of the author followed by a comma, then the initial of the author followed by dot, then comma. But in the second study, the last name of the author is not followed by comma, and actually the initials are followed by dot. This is not good. We have to make the authors, the writing of the names of the authors, unique across the whole studies. After that, as we can see, for a case of sperm concentration, we need 6 variables, 3 for the case and 3 for the control. And in case of proportions, or for example, the pregnancy rate, we need a total of 4 variables, 2 in the case and 2 in the control. It is very important that to write only numbers in these cells, only numeric values, because we notice that when you copy paste from example a PDF, the mean, you can copy the number and a space adjacent to it. So when you paste it in the Excel sheet, it will consider it as a text, not numeric. When we import this onto the statistical data analysis program, it will not read it as numeric. So we can lose this study simply during the analysis. So you have to be careful that you write only numeric values for these analyzable variables. We notice here that in one of the in 2 subgroups use the same control group. This is not accepted, because every group of patients should be used once and shouldn't be repeated during the meta-analysis. So in this case, one of these subgroups should be removed in order not to violate the assumptions of the meta-analysis. So as a final conclusions, the effect size is the mean difference or odds ratio with its confidence interval. The heterogeneity of the studies is measured using the I-squared statistic and or the Cochrane Q-test. Learn how to know what is low heterogeneity and what is high heterogeneity, and that we use, in case of low heterogeneity, we use the fixed effect model to pool the effect size and to have the final results. And in case of high heterogeneity, we use the random effect model and pool the effect size. So The final effect size is represented in the first plot by a black diamond, and we know that if this black diamond crosses the midline, the results are not statistically significant, and if this black diamond does not cross the midline, this means that the results are statistically significant. The concept of publication bias indicates publishing studies with positive outcomes only, and we can assess that using the funnel plot. The sensitivity analysis is used to confirm the consistency of the results and is visualized using the leave one out plot, as we previously mentioned. And it's really important to learn to probably prepare your datasheet and avoid common mistakes during data entry. Thank you so much for your listening.
Thank you very much, Dr. Ahmed. This was really a very, very important presentation, and I congratulate you for bringing so many important points in front of all of us. It is really important in this day of when you can use this program or that program to conduct the meta-analysis. But it is really important that you have a really smart, knowledgeable, experienced statistician who's guiding you in terms of doing the studies for meta-analysis. Meta-analysis is like walking through the forest. And to find that black diamond, you may spend all your age and you will never find it. And the data that will come out of the statistical program will be total garbage because nobody will be able to tell you all kind of mistakes that are happening, whether it is a publication problem, whether it is sensitivity analysis. There are so many things that one must understand. So meta-analysis is not a game. It's not a toy that anybody and everybody can just use by taking a software and thinking that they can just put all the garbage in there. You will get the garbage out. So remember, learning about it really empowers you how to interpret the results of meta-analysis and make a difference and make you realize whether it is a good meta-analysis or it is an average meta-analysis or it is really a poor meta-analysis. This is really important, as you heard from Dr. Rosella, that there are apples and oranges, and it is you who is the consumer must understand how to really tell what it is. So thank you again for a very, very important presentation. The very first time in the world somebody has provided this type of illuminating lecture. Now we bring our next presenter, Dr. Naveen Kumar. Naveen is the head of our virtual training program, and he is going to educate us and tell us what we are doing in the Global Andrology Forum to empower you to learn about many things that are important for you to understand how to conduct meta-analysis. So let me have Dr. Naveen go ahead and speak and tell what he will be doing.
Thank you, Dr. Agarwal and Global Andrology Forum for inviting me and providing me an opportunity to as a speaker in this webinar on basics of advanced research. I'll be speaking on training opportunities in systematic review and meta-analysis at the Global Andrology Forum. The learning objectives of my talks are global research collaboration in systematic reviews and meta-analysis, and I'll be introducing the Global Andrology Forum virtual training platform and the benefits of undergoing training under this platform. Thank you.
Thank you very much, Naveen. Let us begin his presentation now.
Hello everyone. I am Dr. Naveen Kumar. I am an assistant professor in Department of Urology at All India Institute of Medical Sciences, Patna in India. Currently, I am working as a co-leader in Research Team 12 and as training head in Global Andrology Forum. I welcome you all to the second Global Andrology Forum webinar on basics of advanced research. I will be speaking on the training opportunities in systematic review and meta-analysis at Global Andrology Forum. The learning objectives of my talk will be significance of global research collaboration in systematic reviews and meta-analysis, and introduction to the Global Andrology Forum Systematic Review and Meta-Analysis Virtual Training Platform. A systematic review and meta-analysis consists of multiple steps. We have to include many studies and we have to give a conclusion on the basis of the analysis of those studies. So the first step becomes problem formulation. We have to formulate a problem and we have to generate a hypothesis for which we have to search the literature. After searching the literature, we screen the potentially eligible studies after excluding the studies which are not relevant to the systematic review. Then we have to critically appraise the studies to get the quality of evidence, and only those studies with better quality of evidence are included. Then the data is extracted and the data is analyzed with statistical methods. And then the data synthesis is done, which is called meta-analysis. Finally, the data is reported and disseminated by publishing in a good journal. After reanalyzing the data, we can update the findings also in a systematic review. Coming to global research collaboration. Nowadays, there has been an explosion of evidence which leads to when we conduct any systematic review or meta-analysis, it becomes very large, which requires intense time and resource. So global research collaboration helps us in working together of scientists and researchers across the globe to achieve a common goal of producing scientific knowledge. It has been made possible with the help of technology like online shared research platforms which allow participants to put together experimental tasks as designated and also host the studies on their servers. So researchers do not have to set up their own websites and also help in collaborative document editing, which leads to smooth coordination and lesser inconvenience. Tools like WhatsApp groups and regular emails and online hosting platforms are used for effective coordination and communication. And we can also track the progress and know the individual contribution of members in a research team. Global research collaboration is very important in the conduct of a systematic review and meta-analysis. It helps in enhanced creativity and innovation as participants from various backgrounds lead to their own ideas and which helps in conduct of a systematic review. Also, the people can have access to resources and expertise which is not easily available in their own institute. It can be shared globally. The impact increases and visibility also increases due to the networking between various collaborators, which helps in increased reach of the research article. We can tackle complex problems also by doing research collaboration, as there are many problems which cannot be solved by a single person, but in a team there are many people with a variety of backgrounds which can help in tackling complex problems. Capacity building and skill development occurs due to research collaboration as the participants learn many new things during the conduct of a systematic review and meta-analysis. And there are many challenges for which we can take help of the senior members in the team to overcome those challenges. So research collaboration is nowadays a necessity while conducting a large systematic review and meta-analysis. Coming to the introduction of Global Andrology Forum Systematic Review and Meta-Analysis Training Platform. It is free for all the Global Andrology Forum members. They have to sign the research agreement form and send it to the training team, and then they can get enrolled in this training platform. This training program is based on a novel customized online platform based on Moodle to impart a comprehensive training to the participants on various steps of a systematic review and meta-analysis so that they can increase their efficiency while being part of a real systematic review or meta-analysis. This comprehensive training includes selection of topic, review of literature, eligibility screening of all the articles which are relevant to the study, quality of evidence assessment, data extraction from the studies which have high quality of evidence, and then validation of the extracted data. This training is hands-on and interactive, and there are modules which simulate tasks in a real systematic review and meta-analysis. There are specific trainers for each task who provide feedback based on the performance in the assignment in a module. The highlights of the program are structured modules, a synchronous format, timely completion, iterative refinement, and constructive feedback. So the course is divided into 5 modules, which encompass all the steps of a real systematic review and meta-analysis, including initial topic selection, article collection, sorting and eligibility screening of the articles, quality of evidence assessment, data extraction, and data validation. In addition, they get to read and see the videos regarding the introduction to a systematic review and meta-analysis. This is an asynchronous format which is delivered via a customized novel platform based on Moodle. The program offers flexibility, clear instructions, including video tutorials for assignments in each module. The trainees read all the material, then they submit the assignment, which is evaluated by a trainer, and then they get the feedback. So this is an asynchronous format, and the assignments in each module come with deadlines. However, ample time of 2 weeks is provided for completion. The trainees can submit their work early and progress to the next module upon receiving the grade by the trainer and achieving the necessary score. However, if they cannot pass the assignment in one time, they are encouraged to refine the assignments through multiple iterations until they meet the desired standards. Constructive feedback is provided in detail on the assignments by the trainers, emphasizing the strengths and pinpointing areas for improvement. Guidance on addressing deficiencies is also provided. So this program is a wholesome program which includes all the steps of a systematic review and meta-analysis in a structured format, and this after completing this program you can actually take part in a real systematic review and meta-analysis. All the trainees are assigned a specific trainer. The trainer is effective at virtual facilitation, and he holds the trainee's hand and guides them through the various modules in the training platform. He will also be responding by direct messaging on the platform, WhatsApp or emails to any queries the trainees have, and the trainer also reminds them continuously and regularly about the deadlines. The trainer provides the feedback regarding the assignment, and if there is need for improvement, the trainers ask the trainees to repeat the assignments to get the best out of them. Currently, Global Andrology Forum is having 13 research teams with team leaders from all parts of the world. Apart from the team leaders, there are 123 team members in this team. Each team works on a different systematic review and meta-analysis, and after completion of this task, they move on to the next research project. So this helps the trainees in being part of a systematic review and meta-analysis, and they also get co-authorship in a good publication. According to a study on the demographics of researchers in Global Andrology Forum Systematic Review and Meta-Analysis, 75% of the participants were males. They had many types of degrees like MD, PhD, Masters, and various other levels. They were in professions like clinical urologists, andrologists, basic scientists, researchers, and other professions. They had various degrees of experience in scientific research, ranging from 0 to more than 20 years. Half of them had not published any systematic review or analysis previously. So we can see that researchers in the Global Andrology Forum teams come from varied backgrounds, and after taking part in the training, they all come on the same page to conduct the systematic review in a coherent fashion for the best results. The benefits of this training program are manifold. It provides support for diversity and inclusion, especially for the introverted trainees, breaking the language barriers as they get training on a common platform in an asynchronous format. All the trainees are already established in their own profession and they have a very busy schedule, and this type of training reduces the need for frequent meetings and interruptions. After the trainees submit all the assignments, the trainers provide detailed feedback, both positive and negative, for the specific modules. Also, since the participants in the training come from all across the globe and they are in different time zones, Due to the training being in an asynchronous format, there is increased flexibility and autonomy for the trainees, leading to better grasp of concepts in conducting a systematic review and meta-analysis. The GAF SRMA virtual training platform helps in better comprehension of conduct of an SRMA due to the assignments simulating the tasks in a real systematic review and meta-analysis, along with all the other benefits already mentioned. When the trainees are inducted in a real systematic review and meta-analysis, the chances of errors are reduced since they have already completed these tasks during their training. All the participants in research team are already acquainted with the process, so there is very less communication gap among them, and all the participants are on the same page, all of which results in a high quality output in a short time in the form of a well conducted systematic review and meta-analysis. I thank you all for patiently listening to my talk on the introduction of the GAF SRMA virtual training platform. Now I would invite Dr. Hiba Alipur, who is the leader of the research team 12 and the guest management member in the Global Andrology Forum, to talk about the details of the training platform.
Thank you very much, Dr. Naveen, for an excellent presentation describing to all our listeners from all over the world. We have over 550 registrations from more than 65 countries since we checked early in the morning, and that number may have changed. What is more important is that not only we are educating you about how a meta-analysis should be conducted, variety of lectures which are devoted by our experts, but we have also created a very robust program to essentially train you from A to Z in terms of holding your hands by a team of trainers who are highly experienced. They are also practicing, they're all working, but they are devoting their time to educate you, to empower you, to learn about doing a meta-analysis. So it is an excellent program, something that you will not find anywhere in the world, where the training is actually going on according to your pace. You are learning every step from A to Z of the things that you have heard from Dr. Rosella, from Dr. Ramadan, from Dr. Ahmed Haraz, which will be the subject of your learning. And you are being guided by a team of almost 7 or 8 of our sharp trainers who are also working in the Global Andrology Forum, but they also are practicing medicine, or they are working in different professions and volunteering their time to educate, to empower all of you. So I encourage all of you to who are not members of the Global Andrology Forum to sign up to become a member, because then you can get the privilege to decide if you would like to take this kind of training, which essentially is free for each and every one of you, whether you are a member or once you become a member. So now we want to go to the next speaker, which is Dr. Hiba Alipur. Hiba is going to take it further and talk about the training opportunities in systematic review and meta-analysis. He will further explore and explain the nitty-gritty of the things that we are offering. So please welcome Dr. Hiba for him to provide a small opening of what he will be talking in his presentation. Hiba, please.
Yes, thank you very much, Dr. Agarwal. As you mentioned, I will be continuing on the topic initiated by Dr. Kumar, and I will provide an overview of the GAF online systematic review course. Now, at the cost of becoming repetitive, I would like to emphasize before we start that this is a very unique course. It has been designed by GAF experts and exclusively for GAF members. And as I will further explain in the presentation, it will be that this is the only online systematic review course that offers participants a complete hands-on experience in every step of conducting an SRMA. And it provides individual feedback from expert trainers, and all of this done at the trainee's own pace and convenience. So with that said, let's go ahead and watch the presentation together. Thank you.
Hello and good day, everybody. It is a great pleasure for me to be a part of this virtual gathering, and I hope you have all enjoyed the presentation so far. Before I begin, I would like to express my gratitude to the organizing team of the webinar and the management of the Global Andrology Forum for providing this platform, which showcases a global commitment to advancing andrological knowledge. In this presentation, I will be providing an overview of the GAF Online Systematic Review Training, which is a significant initiative dedicated to enhancing our understanding and developing our skills in systematic review methodologies, particularly in the field of andrology. In the next few minutes, I will walk you through the procedure for joining a training group. I will share an overview of the training modules, including an insight into the material and content that forms the foundation of our systematic review training. And finally, I will highlight some of the unique benefits that participants stand to gain by joining the GAF virtual research training. This course was initially designed to train and synchronize members of the Global Andrology Forum research teams to carry out systematic reviews as virtual research groups. Now, the virtual and remote nature of this collaboration required standardized approach and protocols to allow for a more synchronized and uniform collaboration and communication among the members. Therefore, this platform was developed and improved by the GAF educational team, and it is therefore exclusive to and free for GAF members. So if you're not a GAF member, you can easily go onto the Global Andrology Forum website where you can follow the links and apply for a membership. As soon as your membership is confirmed and approved, there is an ongoing enrollment for the course. You can follow the training webpage on the website and apply, which will take you to the application form, where it will ask you about the status of your membership, whether you're part of a research team or not, and also some contact information, after which you can submit the form. Once you have submitted your application for the training program, you will receive the researcher or trainee agreement form via email, which you will have to complete and send back. Soon after, you will be enrolled onto the Global Andrology Forum virtual training platform, receiving a confirmation email like what you see on the screen. In the email, you will receive a username and password and a link to log in to the website. The link will take you to the login page for the virtual training platform, where you can log in, and on your first visit, for security purposes, you will have to change the provided password with a new password, after which you will gain access to the platform, and you can follow the My Courses link, which has been marked with a red box in this image, to gain access to your course. Once you log into your course, this will be your dashboard. This will be what you will see for your course. As you can see in the middle, we have a list of the modules. I will go through them briefly in the next slides. But what is very important in a training is communication. And as you can see on the right side of the screen here, there is a panel with the names and the lists of the trainers that you will be communicating with, you'll be working with. So you will be able to talk to them by clicking on their name and writing them a message, or simply going up here to this icon, which will open the messenger window on the side. And in here, you will have your groups, your private contacts, which you have been communicating with as a one-on-one communication. By clicking on their name or searching for their name, you can start talking to them in real time. And if they are not on the platform at the time when you're writing, they will receive your message via email, assuring that your message will not be missed. As for course contents, you will be able to see a list of the different modules in the course on the left side of the screen at all times, and these will cover different topics, including the principles of systematic review and meta-analysis, how to perform rigorous literature search, how to sort and filter the literature based on the strategy defined in your protocols, the selection criteria and how to screen for eligible articles, the critical appraisal of articles and how to assess for risk of bias. There is also modules on data collection and data entry and meta-analytical strategies. And last but not least, interpretation of the findings and synthesis of evidence. As I mentioned before, once you log into the course, you will be able to see a list of the modules on the panel on the left side of the screen. By clicking on any of these modules, you will be able to see the contents of the module underneath it or on the main screen. Now, I would like to emphasize here that this course is an asynchronous, self-paced, and self-directed course, which means that you will not have to be online at any specific time. You can simply log in anytime at your convenience and access the learning material or continue working on the assignments. Now, the aim of the introduction module is for you to develop a fundamental understanding of systematic review and meta-analysis. And to do that, you will need to gain an overview of the research article types and designs, the possible designs for different researchers, how to design a systematic review and meta-analysis, the Prisma checklist, and some knowledge about the Prospero database. Now, all of this, the information will be facilitated by video tutorials. As you can see on the screen, you will simply click on it, the window will open, and you will be able to watch the video lectures, or through the different learning materials, such as articles and guidelines and other documents available on the website. The next module is focused on literature search and aims at sharpening your skills in developing a literature search strategy by using different database features for advanced search and also creating a standardized protocol or formula for storing the folders and files, which would make it easily understandable for other collaborators in a virtual setting. This again is facilitated by a video lecture followed by an exercise. Exercises in all modules, including this one, come with a complete and clear set of instructions on what to do. In this case, you will need to conduct an advanced search based on provided key strings and filter the results by date, sort them by relevance, filter them by article type, and export the results, which would allow you to create an Excel file with different tables, which you will be able to compare. All of this process has been completely explained. Once you're done, you will be able to submit the file for evaluation on the training platform. The submitted assignments will be individually reviewed and evaluated by our team of expert trainers who will check the assignments for the quality, how accurate was the task done. In the first exercise, it would be the search. The independence, whether everything was done correctly or whether you required assistance to improve it, and timeliness on whether you finished everything on time. And once that is done, you will receive a one-on-one private feedback by the expert trainers. Now, I would like to emphasize here that this is one of the most unique characteristics of this course. Based on our scoping review, there is no other systematic review, online systematic review course that provides a one-on-one expert trainer feedback, whether it is a free or a subscription-based training system for systematic reviews. The next module aims to further expand your skills in advanced research, sorting, and filtering, while also providing the required skills for you to screen and review articles based on title and abstract to determine whether they match the eligibility criteria and can be included in the systematic review or should be excluded. Similar to the previous modules, these are facilitated with video lectures and learning material, and again include an exercise where you will follow the instructions and submit your assignment for evaluation on the platform. Continuing to the next module, the aim is for you to become familiar with quality of evidence assessments. This is again facilitated with a video tutorial along with several guidelines and articles which are available for you to read, and also an exercise which will include the evaluation of 2 articles by applying tools such as the Cambridge checklist in case of observational studies, or the Cochrane risk of bias, the consort guideline, or the Jadad scale in case of randomized controlled trials. The next and final module will try to further improve your skills in evaluating the quality of evidence assessments, and also develop your skills on data collection and data entry into the templates. This is facilitated by a video tutorial explaining the details of the procedure and the protocols, and also an exercise where you will put all that into practice. I would also like to add that the exercises for each module, passing the exercises for each module is a prerequisite for gaining access to the next module, which means that you will be able to do this at your own pace. So the sooner you finish an exercise, the sooner you will have access to the next module, which means that you will be able to finish the whole training at your own pace. And the final module is a multiple choice question quiz to evaluate the skills acquired throughout this whole training program. Once you have successfully passed this quiz, there will be one final assignment, and that will be to conduct a real SRMA study. Of course, we don't expect you to do it alone, and you will be joining one of the GAF research teams as a researcher. I'm sure you're familiar with the GAF teams, and this will allow you to improve all the acquired skills throughout the course. In addition to that, you will be learning how to interpret the findings, evidence synthesis, and also gain a lot of experience with scientific writing. Review about the features and characteristics of the GAF virtual training. It is not that difficult to see the advantages of this new way of learning. The course is exclusive to and free for all GAF members. It is held as an online, self-paced, and self-directed course, which provides great flexibility in schedule, accommodating researchers from different time zones, and also the researchers with the busy work and life schedule. All the learning resources and material, including the video lectures and tutorials, are available for you at your convenience, so you can watch and study them at your convenience when and where you wish. There is an online live support by the training faculty, always ready to provide help with the training material and other questions. A total of 6 exercises with sufficient time to carry out each of them, and also the possibility of multiple attempts for each exercise. The personalized and constructive feedback provided by this course is unique and is not available in any other free or subscription-based systematic review course online. And the year-round registration means that you do not have to wait for a round of the course to begin. You can simply enroll and start working on this training program at your convenience. Advantages also continue beyond the initial phase of the training where you have actually gained the skills to be able to carry out a systematic review. When you are offered an appointment as an active researcher in one of the research teams, where you will be able to work on a real systematic review, gain real life experience in a very supportive research environment, and this will allow you to gain more valuable skills in scientific writing, critical thinking, effective communication, virtual collaboration, teamwork, professionalism, flexibility, time management, punctuality, networking, and many other things that will only be possible to gain in a real work setting. appointment as an active researcher and becoming a member of one of the research groups provides the opportunity to be rewarded with authorship in a high quality scientific publications and also to benefit from many resources provided by GAF, which include idea development, preparation of research protocols, project registrations on Prospero database, for example, resource allocation, project supervision, scientific support, troubleshooting, statistical support, creation of high quality figures, scientific review and editing, final drafting of the manuscript, plagiarism check, journal selection and manuscript submission, including the handling and the fees for submission, and also revision and resubmission of the submitted articles. And on that note, on behalf of myself and the GAF education team, I would like to thank you for your time and attention.
Thank you very much. That was Dr. Hiva. Dr. Hiva Alipur, he has provided an excellent presentation today, something which really breaks down all the important elements of the training that is being provided by Dr. Naveen and him together along with several of our very distinguished trainers. You learn about how the training is being conducted step by step. It tells you that it can be done on your own pace according to your convenience. It is completely free. But most important to me and to all of you is the fact that this training is really, I think, something which has not been provided anywhere else in the world, is that it is not just an automated training that you go and watch some video and just have no satisfaction of clearing your doubt with a real human being. Here we have a team of experienced researchers who are actually themselves involved in conducting or guiding systematic review and meta-analysis in many projects, who are available to you 24/7 to provide their guidance and feedback right there, then and there. So this is the human element which makes the big difference, which is really, I think, the main advantage. Advantages that he has told about the GAF advantage, which I don't need to repeat. So please, now I want to thank Dr. Hiva again, and we move to the last phase of our presentation, which is a take-home message by Dr. Rupin Shah, who is going to break it down and distill it into a small amount of information that you can take it. Dr. Rupin is our senior advisor. He's a very accomplished andrologist and a senior advisor in our Global Andrology Forum. And he is going to provide the take-home message. And as soon as this finishes, there are just a small wrap-up, and we will end the program. So I welcome Dr. Rupin and ask him to take over now. Rupin? Rupin, you are muted for some reason. Let us although you're on
problem.
Yeah, go ahead.
Now
please.
am I audible?
Yes.
Am I audible now?
Yes.
Sorry, I think when I plug in my AirPods, somehow the mic changes. So, well, congratulations to all of you who have sat very patiently, but actually, I think it's been an incredibly informative and amazing, well, morning, afternoon, evening, depending on where you are. We've had excellent lectures, very comprehensive and very educative. I cannot in 5 or 10 minutes summarize the wealth of information. And of course, those of you who are serious will need to go back to the recordings to listen again and then come back with your question, but a few important messages. Next slide, please. So we started with a wonderful talk by Dr. Rosella, who is a very well accomplished researcher. So all the speakers today are people who have been working hands-on. They're not theoreticians. Each of them has worked on and published many SRMs. Rosella has done so for GAF and also many others on her own. And she gave a brilliant talk explaining what is a systematic review, what is the importance of asking the right question, how to frame that question using the PICO or the PICO models. And all of that is extremely important because all too often we come across projects which are garbled because the researcher doesn't have precise thinking. Next slide, please. So all these need to be in turn done in a very stepwise manner. She has explained wonderfully how the search would be performed, how we use multiple search engines, how the screening would happen, the actual flow chart of the total number of abstracts retrieved, then screened, then rejected, then the full papers, and the entire flow chart. She's also explained how the quality of a meta-analysis is so important because there are many published SRMAs, but the quality of that meta-analysis will depend on the input of the quality of the papers. The role of Prisma in making sure that you've carried out all the steps were listed. And of course, when you go through the training program, all these with the original references and the data would be provided. Next slide. Now you can build a grand mansion, but if the bricks you use to build that mansion are weak, the mansion will crumble. So the studies that go into a systematic review and a meta-analysis, and the quality of those studies is very important. And Professor Ramadan did a brilliant job in explaining the kinds of studies, whether they're observational, case-controlled, randomized, controlled, uncontrolled, and understanding that a lot of people often make mistakes while categorizing these studies. Next slide. Is very important. And I think the clarity with which he showed the timeline, prospective, retrospective, what can be included in which manner of study is very, very important. And only if you're able to precisely understand what the study is, and as he pointed out, sometimes the title, sometimes the abstract, sometimes the method will tell you what is the study. And not infrequently, you will find that the author themselves have wrongly labeled the study, and the reviewer and the editor have passed it because they've not paid attention to these basics, which are so important to doing good research. Next slide. And after that, we had, of course, the master statistician who puts it all together. And Dr. Ahmed very clearly explained how you would get either data in figures or in proportions and what data entry is needed. Very, very important point which he highlighted and which I'd like to repeat because he's the person, next slide, who sees all our SRMs and does the analysis. And time and again, he'll come back saying, this sheet has wrong data. There's a comma instead of a full stop. There is text instead of a figure. There's percentage mentioned. So it's very important to ensure that the data is clean. And he beautifully illustrated the flow of information, how the data would be entered, what are the entry points, how it would be analyzed, how you will see the odds ratio, whether it's statistically significant or not, how there is a forest plot, what is the final effect. Each of these, you need to go back and revise them because every paper that you read will have the information. All too often as clinicians, you just gloss over those figures because you don't understand what they mean. But hopefully through the workshop today and a revision of this, you will be able to critically look at papers and say, oh, this crosses the 0 point. This study is not significant. And you can smirk at the neighboring person who has not understood a little bit of the graph that you were looking at. Next slide. And finally, of course, all this has been put together. Next slide, please. In an amazing training program. It started a couple of years ago, initially very manual with videos and training programs created by Rosella. further refined by Muhammad Arafa. But all that was exhausting because it was time-based, individually performed. And as Dr. Naveen and later Dr. Hiva pointed out, they've created something brilliant. I've not looked at all the programs in the world, but I doubt whether there's a program which is so beautifully structured to make learning so easy. You probably have to pay hundreds of dollars if it is available commercially, and here it is being offered for free. And when you heard the presentation first by Naveen and then Hiva, seeing the flow of events, I'm sure that you would want to attend this program. And of course, the information is out there. And if you have any doubts, you can write to us. And I would strongly recommend that you do the program and take advantage of what Hiva pointed out at the end, that you can get hands-on participation in the conduct of a real live systematic review. So this was just a very quick summary of some key take-home messages. But most important, what I'd like you to take home is that whether you're a clinician or a researcher or a clinician researcher, you need to understand what you read, whether the quality of the paper you're reading is good, whether the data or the conclusions are justified, whether you should use that to change your clinical practice. And that can happen only when you understand all that was presented today. So with that, I'm going to hand it over back to Dr. Ashok, and a very, very big thank you to all the speakers who've done a fabulous job, and to the participants who have stayed here for 2 hours, because your presence tells us that there are people who are interested in good science and encourages the GAF, the Global Andrology Forum, to continue its work. Thank you.
Thank you very much, Rupin. I think you summarized it so well. And I am so happy that we have an excellent presence of delegates who are attending the program, which is being conducted by the Global Andrology Forum. And this is our first webinar of this year. Of course, we have many other lined up, but we are very proud of the way that this program went through. And I want to thank each and every single person who was involved in preparing for this event, including our speakers, Dr. Rosella Canarella, Dr. Ramadan Saleh, Dr. Ahmed Haraz, Dr. Naveen Kumar, Dr. Hiva Alipur, and Dr. Rupin Shah. Dr. Ramadan took a central role in terms of making sure that every presentation, every outline of the talk that the speakers have to give went through various phases of his scrutiny and review and correction, just like you are publishing a paper in a very important journal like Nature or Science. Ramadan made many types of recommendations which our speakers graciously accepted. And what you see in even the slides that they prepared, he went through each and every slide to make sure that the quality of the presentation and the clarity of the information that is being shared with you is of the highest quality. And I want to thank, a special thanks to Dr. Ramadan for his role. Also, I want to thank our coordinators here. Next slide. If you don't have, I think they didn't have the chance to prepare the slide, but the people who are behind the scene, Miss Daniela, as well as Miss Liliana, who are really the brain behind webcasting of this program today. We wouldn't be having this fantastic program without their extreme amount of time and effort and preparation that have gone into it. I want to really thank on behalf of everyone, including the management, their efforts and their sacrifice in organizing this program. So thank you, Daniela. Thank you, Liliana, for making this event memorable. For last few points, this program is being recorded, and in the next few days, once the program is ready and edited, this will become available. We will send you the link on the YouTube where this program will be hosted under GAF account. so you can watch that program free according to your convenience. Second, we are now opening the link to take the post test for those who have taken the pre-test as well. They will be eligible for a training certificate if they are able to get 75% or more of their questions correct. Uh, and there are only 20 questions, and I hope you will really take the opportunity to take this multiple choice. But we have really given you almost a month of time to take this test. You don't have to take it today itself. You can take your time, but that will allow us to then select you if you have done well for training certificate. For those who would like to just take the post test, you can still take the test, but you will not be eligible if you have not done the pre-test. So pre and post are together to get a certificate. For attendance certificate, you are eligible to get the certificate even if you don't take pre and post, but you will have to do a satisfaction survey for the link for which you have been provided. So you can go to that link at any time and you can complete that survey. It is very important for us to receive the feedback so that we can really take those suggestions that you have to improve our program further. Remember, this is a voluntary program. Nobody is being paid here. We are all devoting our time for the improvement of science in the world, especially in the field of andrology. So we really are all in the same shoes as all of you are. We are not personally benefiting from this. Our benefit is that we are trying to share our knowledge and experience so that all of you can benefit, everyone, and that will really benefit the field of andrology. It will benefit all the clinicians. It will benefit our patients, and that is our really the mission and goal. So I want to thank each and every one of you for attending this program. And Daniela, do we have any slide of any kind to show, or are we done at this time? I just wanted to see. Okay, so you can become a GAF member, and this is again, you just go to the internet on Google or anywhere and just search Global Andrology Forum, and you can go to our website and read about it. If you are interested, you can apply for the membership. Application is very easy, very simple, and it is completely free now and ever. So whether it is training, whether it is lectures, whether it is scientific courses and learning or manuscript, all of those opportunities are free for members of Global Andrology Forum. We also want to tell you that you may have questions from this uh, today's presentation. So you can send the email that has been given to you and has been shown earlier. I don't know whether we have another slide which shows that, Daniela, if we have that, please project, which you can use to send all your questions via email. And that will allow us to then review those questions and then answer those into a Q&A session that we have planned in about 2 weeks' time. So you don't have to worry that I didn't get a chance to speak and clear my mind from Dr. Ahmed, who showed so many forest and black diamond. How do I find this black diamond? We will provide you the answer. So please